It is not the symptoms that they feel, it is not the thoughts that they have about their symptoms that is the problem. It is the fact that they cannot stop worrying about these symptoms. This is what maintains health anxiety according to metacognitive therapy. Catastrophic misinterpretations. This is how different therapy approaches, especially popular therapy approaches like CBT, conceptualizes health anxiety. So catastrophic misinterpretation means that once you notice a bodily symptom or a sensation in your body, you start to interpret it as something serious or dangerous. So let's say if you notice a lump in your throat, you may think that this is cancer, I will die. Metacognitive therapy looks at health anxiety from a different perspective. So let's look at that. So let's imagine someone called Emma. She has a birthmark on her hand and she's been constantly checking this for the last month. She's convinced that this birthmark is malignant. Maybe there is some skin cancer. Emma's doctor has told her that there's nothing wrong with her birthmark and she's fine. Therefore, she seeks cognitive behavioral therapy to deal with her health anxiety. In therapy, Emma and her therapist focus on how she interprets normal symptoms in her body. And they try to look at these thoughts that she's having of what if I'm ill, what if this is cancer, from a more realistic perspective. She learns that because she has this thought that maybe her birthmark is cancerous, it doesn't mean that this is so. And she can think of different alternative ways to relate to that birthmark. Maybe this is normal, maybe nothing has changed. This helps her tremendously and she does feel better. She leaves therapy happy and content until some months later she notices a lump in her throat. That makes her start worrying and she's back into the cycle of health anxiety. According to research, 30 to 50% of the patients with health anxiety recover from treatment with cognitive behavioral therapy. It seems that the relapse rate is also very high. So people do recover with cognitive behavioral therapy, but after some time they experience relapse. So there must be something else going on that maintains and causes health anxiety that is not addressed in cognitive behavioral therapy. According to metacognitive therapy, that thing is worrying and beliefs about worrying. So although Emma learns that because she thinks that her birthmark is cancerous, it doesn't mean it is so, that doesn't stop her from worrying and take control over this process that she does engage in every time she notices a symptom that she thinks is scary or serious. So Emma continues to worry whenever she finds something new. And this is the reason why she keeps having setbacks into health anxiety. So when Emma comes to metacognitive therapy, we look at her worrying process. Because every time Emma notices a sensation in her body or a symptom that she's unfamiliar with, she starts worrying about that. What if this is serious? What if this is cancer? What if I'm gonna die? How am I gonna cope with this? This is too unbearable. How will my family take care of themselves without me around? And she keeps wallowing in this cycle of worrying and ruminating about her symptoms and the consequences of being ill. The reason why Emma starts worrying in the first place is because she has a belief that it is helpful to worry about physical symptoms. So whenever Emma notices a symptom in her body, let's say this time she notices a lump in her throat, she starts worrying because she has a metacognitive belief, which is an assumption that we have about our thoughts, about our feelings. This metacognitive belief goes, it's important to worry about my physical symptoms in order to prevent something serious from happening. So worrying is helpful, worrying is important. That makes Emma start worrying whenever she notices this lump in her throat, whenever she feels it. However, this worrying exacerbates how she feels. It actually makes her anxiety worse. The reason is that the brain doesn't really know whether we are in a real or imaginary dangerous situation. It does react with giving us more anxiety symptoms because it thinks that it prepares us to flee or fight a situation. So in that sense, anxiety and worrying can be helpful if we are facing a real danger and we need to flee from that situation and save ourselves. But since the brain doesn't know that Emma is in a serious, dangerous situation, the worrying that she does in her head makes her anxiety worse. And she feels panicky, she feels exhausted, She feels tense, and all she can think about is her worrying. At this point, Emma has developed a belief that she cannot stop worrying, that only once she's confirmed by the doctor, by someone else, that there's nothing wrong, that she's not physically ill, that's when she believes she can stop worrying. So according to metacognitive therapy, worrying is what maintains health anxiety disorder, and beliefs about that worrying is helpful or unstoppable is what maintains this worrying process and therefore maintains health anxiety. Now, Emma does a lot of other different strategies as well to cope with the worrying. She does monitor her body a lot. She monitors how she feels, she scans her body from top to bottom, and she tries to notice any fluctuations there might be in her body. And in the case of the lump in her throat, she does notices it a lot because she focuses all of her attention on that lump. The interesting thing is, the more you focus on a bodily symptom that can be completely normal, the more you're gonna feel that symptom. So let's try this with an experiment. I want you to stop this video and notice your right ear. For the next 30 seconds, just notice how you're feeling in your right ear and focus all of your attention to your right ear. When I did this experiment, I noticed how I felt warm in my ear. I also noticed tingling sensations, I noticed a throbbing sensation and some movement, probably from the blood flow. However, I hadn't noticed these sensations before, and these sensations were probably there the whole time. But I did notice it more once I started paying all of my attention to my right ear. What does that tell us? That tells us that the more we focus attention on something completely normal, that sensation seems to be exacerbated and we notice it even more. So normally our body fluctuates a lot. There are a lot of different symptoms, our feelings fluctuate throughout the day. Sometimes our heart beats faster, sometimes our breathing is changed. There are a lot of things going on. We may feel hot, we may feel cold. These things are normal fluctuations of the body, and they happen all the time. So everyone has these fluctuations, but for people with health anxiety, they notice these fluctuations more because they're focusing all of their attention to themselves, their bodies, and how they feel. Now, this exacerbated attention focus on the body and on symptoms only exacerbates worrying. So it leads to more worrying, which then causes more anxiety, which then causes more anxiety symptoms and more bodily symptoms, which then leads to worrying. So it becomes a self-perpetuating cycle that can be hard to break free of if you don't believe that you can stop worrying. Now, Emma also told me that aside from worrying and noticing her symptoms, she does have a whole ritual going on in the morning where she really checks her whole body from top to bottom to see if there are any new changes, if there are any signs of illness that she needs to discover in time. She also looks up a lot of stuff online to make sure that there's nothing wrong. She goes on sites like WebMD and similar sites to read about her symptoms. Sometimes she even reads medical journals to make sure that she understands something in depth, to make sure that she's not seriously ill. She also frequently visits her doctor more than any of her friends or family members would do. And all this is in an effort to seek reassurance. If she doesn't believe that she can stop worrying about her symptoms, she then needs outside external confirmation to stop worrying. That is also the reason why she constantly asks her husband whether she is okay, whether he thinks that she is seriously ill, and whether she will be able to cope. Some people with health anxiety don't necessarily do all these things. However, what they do have in common is a lot of worrying and a lot of self-focused attention. Some people avoid checking themselves, avoid noticing their symptoms if they think that they are seriously ill. Now, this is a type of avoidance behavior. Another type of avoidance behavior would be not to go to the doctor even if you have regular checkups, because you're worried that if you do find something serious, you won't be able to stop worrying about that. So some people put all of their attention on these so-called symptoms and go all on board on checking and analyzing, while others try to avoid doing that and shut off in order to prevent themselves from worrying about their symptoms. Now that we've discovered that what maintains health anxiety, according to metacognitive therapy, is the extensive worrying and the beliefs that activate worrying. So long as the worrying is not reduced and people don't learn that they can control worrying, that they can stop worrying, they will continue falling back into the health anxiety cycle. So if you're suffering from health anxiety, it is important that you seek professional help. It is important that you seek a therapist that is MCTI certified and is experienced. With a therapist like that, you will go through a sequence of the treatment that can help you directly reduce the worrying and also target each of these metacognitive beliefs that could be maintaining your worrying. And the result should be that you have a relaxed relationship with your thoughts. So the next time you experience a thought like, what if this is something serious? What if I'm seriously ill? You can stop worrying about that because you now believe that you have full control over worrying. And now you also know that the reason behind your health anxiety is not the fact that you're experiencing symptoms, but that you cannot stop worrying about your symptoms. So I highly encourage you to go to therapy if you struggle with health anxiety. If you, however, do struggle with some worrying about your health and you would like to reduce that and prevent that from developing into a full health anxiety disorder, it's important that you learn to control your worries. And by controlling worry, I don't mean controlling your thoughts. You are going to have thoughts like, what if this is serious? What if I am ill? What if I do get ill? But it's important that you don't worry about them. So having thoughts is not the same thing as worrying about thoughts. The worrying is asking yourself a lot of questions about the thoughts that you're having. So you're getting into an analysis mode and you think about the thoughts and you ask more questions such as, what if this is true? How will I cope? And you imagine catastrophic scenarios of how things would look like. Maybe you're imagining yourself being completely ill with your family around you and you're dying, how that will look like, and you worry how you'll be able to cope. So this worrying process is something that you actively do, although it doesn't always feel that way. So it's important to stop that whenever you experience having a thought, what if I'm seriously ill? Or you're experiencing a symptom and you think that this is something important. In order to stop worrying and stop yourself from developing health anxiety disorder, it is important that you only allocate a specific amount of time for your worrying and for your checking and reassurance seeking and Googling your symptoms. Ideally, that would be half an hour every day or once a week, depending on your need. So let's say you plan a half an hour worry window in your evening. And the rest of the day, try to postpone all of your worries, all of your checking behavior for that time. So go on with your life, go on with your day as if nothing had happened, and decide that you will only deal with these thoughts and symptoms in your worry time. If you do that, let's say if you go from worrying about your symptoms on and off for 3 hours every day, but you do reduce that to 20 minutes or half an hour, that would make a huge difference in how you feel. Because you won't feel so anxious, you won't feel so many symptoms, and you'll be able to focus your attention on other things. So postpone worrying, postpone checking your symptoms, postpone reassurance seeking. Make a contract with yourself today that from now on, you will only do so half an hour every day, not more. On MetacognitiveTherapyCentral.com, you can read about health anxiety, you can read about these metacognitive beliefs that are so important and do drive health anxiety, and you can read about how treatment works and some of the literature that is out there about metacognitive therapy for health anxiety. Thank you for watching.